Welcome to the pharmacy training video for the Smartez elastomeric infusion pump system. This video will introduce you to the Smartez elastomeric pump and familiarize you with the steps required to properly use this device for safe and accurate medication infusion. The Smartez disposable elastomeric pump infuses medication at a fixed flow rate using pressure from the balloon-like drug reservoir or ball, against the fixed diameter taper of the administration tubing. The key components of the Smartez pump, as identified on this diagram, are the fill port, the soft outer cover, the multi-layered elastomeric membrane, the on-off clamp, the non-DHP PVC administration tubing, the air and particulate filter, the flow restrictor, the patient connector, the patient end cap, the sterile color-coded fill port cap, the disposable protective port cap, the label indicating fill volume and infusion duration, and the label indicating flow rate. Please note, the disposable protective port cap will be discarded by the pharmacist after filling the pump, and will not be connected to the pump when it reaches the patient. This figure indicates the expected flow profile of the Smartez pump. The device is designed to deliver the nominal volume within plus or minus 15% of the nominal delivery time. There are factors that can impact the flow rate of an elastomeric pump. When administering through the intraarterial and subcutaneous routes, where back pressures are expected, flow rates will decrease. The nominal flow rates are based on 0.9% sodium chloride at 31 degrees Celsius, 88 degrees Fahrenheit, as a reference. Use of 5% dextrose will result in 10% slower flow rate, or correspondingly a 10% longer delivery time. Temperature affects fluid viscosity, with higher temperatures generally resulting in shorter delivery times, and lower temperatures generally resulting in longer delivery times. The Smartez pump should be allowed to warm to room temperature before starting an infusion. When the infusion begins, the section of tubing between the filter and the patient end cap should be under the patient's clothing, with the device flow restrictor close to or in direct contact with the skin, to remain near a temperature of 31 Celsius or 88 Fahrenheit. For every change of 1 degree Celsius, the flow rate may be affected by 2.5%. When filled within the minimum and maximum volume recommendations, the impact on flow rate is negligible. Consult the table on page 2 of the technical guide for details on the minimum and maximum fill volumes for each pump. Filling the device less than the recommended fill volume generally results in a slower flow rate, while filling the device more than the recommended fill volume generally results in a faster flow rate. Smartez pumps are approved for use with chemotherapy medications. This table provides examples of infusion durations that can be accurately achieved by over or underfilling Smartez chemotherapy pumps. To fill the Smartez pump, follow these steps. Using a septic technique, first unscrew the disposable protective port cap from the pump, keeping the sterile, color-coded fill port cap attached to the disposable cap in order to protect the sterility of the color-coded fill port cap until after filling. The Smartez pump can be filled with either a syringe or an automatic filling pump. Remove any trapped air from the filling device, then attach it to the fill port on the Smartez pump. Do not over-tighten the connection to the fill port. To fill the pump, first, close the on-off clamp. Then connect the filling device and fill the pump with no more than the maximum recommended volume. When filling with a syringe, it is recommended that the syringe is kept in an upright position with the plunger base resting on a workbench. Always push the barrel of the syringe downwards toward the workbench. Repeat as necessary. To prime the administration tubing, open the on-off clamp and loosen the patient end cap. Hold the patient connector above the filter while priming the tubing. Medication will start to flow and fill the tubing. When all air is expelled, tighten the patient end cap. Then close the on-off clamp. When used with chemotherapy or medications prone to precipitation, it is recommended that the tubing is primed with 5 to 10 milliliters of diluent before medication is added. First, verify that the clamp is open and the patient end cap is loosened and add the 5 to 10 milliliters of diluent to the pump at the fill port. Remember to hold the patient connector above the filter while priming the tubing. When all air is expelled from the tubing and a droplet is visible at the patient connector, tighten the patient end cap and close the on/off clamp. Finally, fill the remaining volume with diluent and medication. If storage of the filled pump becomes necessary, refer to the drug manufacturer's package insert. Once the Smartez pump has been filled, remove the disposable protective port cap from the sterile, color-coded fill port cap. Then attach only the color-coded fill port cap to the filled Smartez pump. Finally, make certain to label the filled Smartez pump with the appropriate pharmaceutical and patient information. Before working with the Smartez pump, make sure to prepare a clean, dry work area and properly wash and sanitize your hands. Gather the supplies needed to start the infusion, as directed by your healthcare provider or protocol. To begin the Smartez infusion, first clean the patient's vascular access site as directed by your healthcare provider. Next, verify that the clamp on the pump tubing is in the off or closed position and remove the patient end cap. Now, connect the Smartez pump by inserting the patient connector into the vascular access site and turning the pump tubing clockwise to secure the connection. Make certain that the Smartez patient connector is tightened securely to the patient access site. Once the Smartez pump is connected to the access site, you may begin the infusion by opening the clamp on the pump tubing. It is recommended to move the clamp to a new section of tubing and inspect the tubing for kinks at the previously clamped section of tubing. If kinks are observed in the tubing, roll the tubing between your fingers to release the kink and ensure that the infusion can flow freely through the tubing. Patients should be advised to keep the Smartez pump connected for the prescribed duration of therapy. As the infusion progresses, the appearance, shape and feel of the Smartez pump will change. For your reference, these images show the differences in the appearance of the Smartez pump when it is full, while it is infusing, and when it is empty. At the beginning of infusion, the inner membrane and soft outer cover will be taut, and the pump will be round and firm. During infusion, the inner membrane will decrease in size and the soft outer cover will begin to form wrinkles. At the end of the prescribed infusion time, the inner membrane will completely deflate, and the soft outer cover will collapse. Review the Smartez technical guide before using the pumps. Include these details in the patient education for Smartez pumps. Do not immerse the pump in water and protect the filter from getting wet. Avoid getting alcohol or detergents on the filter. Avoid sleeping on the pump and do not exert pressure on or play with the filled pump. Make sure the patient connector is securely connected to the access site. The Smartez pump should remain connected to the patient for the prescribed infusion duration. Because temperature can impact flow rate, advise patients to keep the section of the tubing from the filter to the patient connector under clothing and in contact with the body. Avoid prolonged exposure to extreme hot and cold, and allow the pump to warm to room temperature before starting the infusion, if refrigerated. After the prescribed infusion time has elapsed, close the clamp on the pump tubing and then disconnect the pump from the vascular access site. Discard the empty pump as directed by your healthcare provider. Finally, flush the patient's vascular access site as directed by your healthcare provider. Progressive Medical periodically updates the drug stability guide as new data becomes available. Please consult the latest drug stability guide for recommended drug stability data. Progressive Medical also offers administration guides for both patients and nurses to support patient infusion with the Smartez pump. If you have any questions, please contact your local Progressive Medical representative or the Progressive Medical customer service team and thank you for the opportunity to support you in providing optimal care for your patients.